Hey guys, it's Liz Peavy-Toe here, and wanted to give you a little bit of an update today. As many of you know, we were burying my father, and who passed away on Monday. And as many of you know, yet again, my mother was admitted to the hospital not before last for congestive heart failure, a new diagnosis, and she was transferred to another facility last night. So that she could see a specialist. And I wanted to hop on here because I've had to deal with something extremely egregious today that I shouldn't have had to deal with, and I want to hop on here and appeal to all the nurses and doctors that I know, because I feel like this is something that definitely needs to be addressed, not only for because of what I'm going through, but I see it going on. I've seen it go on for many years, because if you don't know me, I am a registered nurse myself. I've been retired for 2 years because I experienced total burnout. So what happened is my mom was transferred to this facility. Last night I came home during the transfer and switched places with my brother and sister, because I hadn't slept pretty much at all in 2 days. So I came home, went straight to bed, and she got what's called an echocardiogram yesterday, and they couldn't find the records, and they said they were going to redo the echo. And my mom said, well, I already had an echo, and they basically told her that she didn't know what she was talking about, and she was mistaken because there was no record of the echo. So this morning, whenever I woke up and found out that that was going on, I asked her if they had found the echo yet, and she said no. And when she told the nurse that I was asking about it, and she said something to the effect of, to my mom, if she's so sure that they did an echo, she can call this other hospital, I'm not going to mention the names, and get it herself. Needless to say, that angered me to a point that I don't know if I've ever been that angry before. I should just be able to deal with my dad's funeral today, and they expected me to call and get this record. My mom is not even going to be able to go to her own husband's funeral, and I'm having to do everything because of that. So I had to call the charge nurse and remind her that it was not a patient's family's responsibility to obtain their medical records from their own facility. I'm lucky that I'm a nurse and I know who to call, what to say, and how to get it done, and they did find the echo. But because of this, I'm pretty confident that my mom's plan of care has been delayed, that it's a possibility that she could have been discharged this morning had the stupid staff last night done their job and not called my mom a liar, basically. So this has added an entire new measure of grief to my life that it should not have been added. And not only that, I have to go to the funeral and leave my mom at this hospital where I feel like they are incompetent. Okay. The point of this, guys, is if you are a nurse or you are a physician, I implore you to bring the care back into healthcare. I've seen it as a nurse, and I've experienced it as a nurse. Total, and I'm not going to read the comments because I'm too upset, but total and complete burnout in the healthcare system. When I just found myself as a totally completed, burned out, and became a jaded nurse, I quit. I left healthcare. I'm so mad. I know what's happened. The whole culture of healthcare has shifted to all these stupid algorithms where you have to be told what to say, how to say it, all based on our freaking satisfaction scores. And in that process, We have taken out the nurses and the physician's ability to deliver real empathy, because we are even told what to say to our patients, how to say it. And when you control your staff in that manner, you take out the human element of care. It's like we have a bunch of robots working in healthcare. And I know there's a lot of you who aren't that way, but as a consumer, I'm telling you, this is the service that we have received from the moment my mom was admitted. And honestly, it's the service my dad got at the VA that ended up with his demise. So, I'm sorry, I don't know if this was just a total rant, but I don't even really care, honestly. I'm really pissed, and I'm heartbroken, and something's going to have to change. And I'm pretty sure when I'm not this exhausted and going through this type of despair, I'm going to have to. So that's all. I'm sorry for ranting, but please feel free to share this with all the nurses you know, because this culture of not giving a shit about patients and their feelings and has got to go. It's got to go. That's all.